Dear viewers, welcome you all to our show, Orthopedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing mask and keeping distance with each other. Dear viewers, today our topic is Ilizarov in hand surgery. Definitely, we are using Ilizarov in every part of our body as well as hand. And our speaker is the one and only, the magnificent speaker, the legendary Ilizarov surgeon in Bangladesh, Professor Mofakharul Barisar. I would like to request Professor Mofakharul Barisar to join with us.
Thank you very much for introducing me.
Thank
Okay.
you very much, sir. Welcome to our show, OSA. Dear viewers, we have a two learned academic panel. One is Professor Novikov, sir, from Russian Institute of Ilizarov Kurgan, and the another one is very enthusiastic Ilizarov surgeon, the Joint Secretary of Assam, India, Dr. Shamsul Huda, sir, from Patna, India. I would like to request Dr. Shamsul Huda, sir, to join with us.
Thank you, Dr. Tanvir, and good afternoon to all.
Thank you, sir, for joining with us. Dear viewers, Professor Novikov, sir, will join with us in the coming part of our program. Now, I would like to request Professor Mofakharul Barisar to share his screen with us. And the topic is Ilizarov in hand surgery. Professor Mofakharul Barisar, would you please?
Okay. Thank you. Thank you very much. Dear friends and panelists, especially Dr. Tanvir, Shamsuddha, and my friend Professor Novikov. Today I'm going to talk on the especially that very good important chapter. I'll talk on the management of open and closed hand fractures using transosseous osteosynthesis. Here I have mentioned here the transosseous means I'll use only the wires, no pins here. You can see here, and whenever we are talking regarding the hand, it starts from the shoulder up to the fingers, phalanges. And today I will talk only on the wrist and the hand. And here I'm going to talk on the management of the open and closed fracture, how we can manage by mini Ilizarov fixators, that is transosseous osteosynthesis. These are all my slides. When in every slides, I'm going to show all these institutes where I've taken training. Kurgan, I love to show this one. Beautiful, fantastic capital of orthopedics. And our National Institute, 1,000 bedded. My present working place here, my center, and this Kurgan. And 4 I am always, just to remember, man, meat, method, and magician. Now, restorative treatment of the hand diseases and injuries remains problematic in spite of significant surgical advances. This is due to anatomic and physiological properties of the hand. Although a small part of the human body in terms of its area, only 2%, the hand comprises 27 bones and 28 joints. Muscular control of the hand function is performed by 45 muscles. The length of the arm of an adult accounts for 44.6% of body length in men and 44.1% in women. The hand makes up 24 to 28% of the arm length in adults. The average size of the man hand is 18 and a female a little bit smaller. You can see here, this is the picture. How beautiful is our hand. And you can see the carpal bones here, 2 rows, just to remember for the young orthopedic surgeons, metacarpals and proximal, middle, and distal phalanges. So, whenever we are talking about the hand surgery, we must think about the indications and the contraindications. You can see here indications: closed and open fracture of the phalanges and metacarpals of the fingers, replantation of the fingers and the wrist, non-united fractures, malunions and pseudarthrosis, post-traumatic stamps, hypoplasia, and congenital anomalies of the bones of the hand for their elongation, congenital syndactyly, joint contractures. Whenever we are talking regarding the contraindications, this is contraindications related to the apparatus, including the wide spread of the pyodermia, inappropriate behavior of the patient. You can see here, whenever you are thinking about the osteosynthesis of the fracture of the hand bones with mini Ilizarov or mini fixator. Nowadays, orthopedists and traumatologists are able to treat a given pathology using nailing, mini plates, transosseous osteosynthesis. The chosen method frequently defines the result. Satisfactory results following intermediate osteosynthesis were reported in 4.6% of the cases compared to unsatisfactory results in 1.5%. Indications for osteosynthesis using the mini fixator, as mentioned above, are closed and open fractures of the metacarpals and phalanges of the fingers. Open and intraarticular fractures with small bone fragments are also well suited for osteosynthesis, as are cases in which there is damage to the tendons and neurovascular formations of the bottom third of the forearm. Whenever we are thinking about the osteosynthesis, the plane of the wire insertion is very important. The bone fragments should be perpendicular to the long bones. And this is very important. And in our cases, when we'll talk about the result of treatment, if we analyze our early and late outcomes, that all showed that we all examine the patient that have a stable treatment results with maintenance of the achieved lengthening, reconstructive pinch, and the cosmetic appearance. Patients reported an increase in pinch force. The improved cosmetic appearance was the result of stretching and redistribution of the skin on the operated segments. Use of many fixators in hand surgery is a method of choice in the treatment of a wide variety of hand pathologies. As I told you earlier, open injuries with extensive destruction of the structures of the hand or traumatic amputation of any of its part, lengthening of the segments, heavy acrocontracture accompanied by dislocations, amputation stumps the fingers with dysfunction of the hands. Now, before going to do any surgery in the hand or any Ilizarov surgery, Professor Ilizarov was always fond of saying, no surgery is justified to do any reconstructive surgery by Ilizarov technique unless he has got the competent idea regarding the technique and the apparatus. Now, dear friends, you can see here for the osteosynthesis of the sharp tubular bones, the mini fixator can be individually installed on the dorsum of a finger or a metacarpal. Each device contains two units for wire fixation. Knots are maintained by longitudinal threaded rods. Now you can see here rod. You can see here rods. This is the knots and how to put everywhere. This is the slotted, this one is the slotted, just is this one also slotted, this is also slotted. These are the mini plates, here, 5 holes, 4 holes, 3 holes, and 2 holes. And this is the way, general view of a mini Ilizarov fixator, how to fix this one. Very simple. This is the wire when you're putting and how to bend the wire. I'll show you, and these are the small mini fixators with nuts and bolts and other apparatus. Now here you can see sequentially these are the all bolts, fixator, threading rods, locking screws, and fixation nuts. Fixation nuts. This is the fixation nuts you can see here. Now, before going to introduce the wire insertion in the small bones, you can see here, this is a very important picture, scheme for the introduction of the wires in the bone of the hand and their fastening in the fixation units of the apparatus. Look at these veins, arteries, nerves, and this is the cross section of the bone, and here is the tendon. Whenever you are putting the wire like this, straight away, then you bend like this. It will be initially it will be straight. When you are putting, you bend like this and cross like this, and you can fix with the nuts and bolts here. So this is the fixation. Before going to put the mini Ilizarov apparatus in the hand, you must keep it in your mind. And now, whenever we are putting, just look at this, transverse osteosynthesis in the treatment of the post-traumatic stamps of the hand. If you want to do a lengthening of this is your one part bone, this is a joint, this is your remaining part. Now see, very simple. You put the wires like this, and this one you can fix this one, and another you two wires you just fix here, and then go for lengthening here. Do a osteotomy. Now you can see here, this is the diagram, how you can lengthening technique for a phalanx or a stamp with mini Ilizarov fixator is longer than 30 mm, that is 3 millimeter. Now you can see here, this is one way. Another way you can see here, the bending of the wires. This is the fixation. You just put, then bend, then you are getting as a result. In this way, you will get a fixation force here, and another wire here, and distally this one. Do a corticotomy, and gradually you can go for lengthening. This is your regenerate bone. So this is another variant of the mini Ilizarov fixator, mounting for lengthening of the middle phalanx. I'll show you later on. This is the congenital anomaly. Even in trauma, you could put like that one. See here, this is the thumb. How, if you want to do a lengthening of this, you can do this way. Fixed like this, and this is a small mini bar. You can fix here and here, and go for lengthening. Now, this is simple. I want to show you. Sometimes you will get this kind of deformity, and very easy. You fix like this, mini fixator, do osteotomy, and this is wedging of this new regenerated bone. Bone is totally corrected. Now, these are the pictures I have taken from my Kurgan Institute when I was there. This is, you can see here, very simple mini fixator. Here written in Russian and English. Ilizarov apparatus, mini fixator, how to put. These are the small olives. You can see, without olive also you can put, but whenever you are putting olive, you are get more stable fixation. And these are the different parts of the mini Ilizarov fixator. Now, you can see here again apparatus for lengthening of the stump. Whenever you are going to lengthen, then how you can put, see here, just 1-2 wires, bend like this, and then again fix it with fixator, bar, put here, and then you can go for lengthening. These are the slotted, washer, slotted washer. This is slotted washer, and your wire bending would be like this, and this is fixed to the bar, and here you can put with the plate, small plate. These are not normal ring. The Ilizarov big rings. These are the mini fixator only for the hand. Now, dear friend, you can see here, this is the fracture. Think about, you can fix this this way and that way. Very simply, externally, you can do that. If you want to go for lengthening, you can see you just put an arch. This is called bow, small bow, and then here you can fix it with the post, and then mini fixator. These rods are very small, 3 times smaller than the normal rods. So this apparatus for simultaneous lengthening of the 4 metacarpal bones. If you want to lengthen, you can put like this. Whenever you'll see, you'll think that this is very difficult. This is not a difficult thing. Only before going to surgery, you should have to know the apparatus, particularly how to put and where to use and where to use. So now you can see here, apparatus for lengthening of the distal phalanx. If you want to go for lengthening, this is also not so difficult. Put one, this is olive, one wire, here olive wire. This is the bow, small bow, and then you fix this one with this, and long plate, small, you can see, even to go for lengthening, see the small wires, and you are pulling from this side, you can go for lengthening of the phalanges stumps. Now, this is for congenital anomaly, wrist, wrist lengthening. This is just picture I have shown you how to put the apparatus. Now, here you can see this is a variance of applications. You can put like this, here left side. See, this is regenerated bone. Bow here, just fixed like this. And gradually, whenever you are going for lengthening, just see, here is the nut, here is the nut. Inside and outside, inside and outside. You just rotate 2 times, 3 times, 4 times, depending upon your case. Now, this is the case, you see how you can lengthen. Very simple externally from do that. This is corticotomy. You can do like that. You can go for lengthening. These are the apparatus for metacarpal shape restoration. Now, here, dear friend, you can see here apparatus for lengthening of the short digital phalanges. If you have short hands, you can do like this. See here, fix. You got this bow. You can fix to two wire, and then two small bar shears. Then you can go for lengthening for the distal digital phalanx. Here only for, you can see here, for stretching out the interphalangeal joint contracture. This is a, if you have a contracture here, limitation of movement in the joint, that is called contracture in one plane, and you can go for lengthening like this. You can correct the contracture of the interphalangeal joint. Now, I would like to share my experience and cases with you, dear friends. Now, see here, 18 years old boy, machinery injury to right hand with auto-imputed thumb, hanging metacarpals, and fractures of the second, third, fourth, and fifth metacarpal. Came with this situation to my center, Gastilo 3A, hanging metacarpal. Then I took the patient to the OT, put the K-wire with Ilizarov, one here and one bow here. And then gradually, sequentially, I have treated this one. Before that, I've checked the vascularity of the hand. It was okay at that time. And then I have gone for lengthening of the thumb because auto thumb imputed, he came to my center. And then I have lengthened this one this way. This is one situation. In another situation, you can go for lengthening, and patient can hold pen with the help of the mini Ilizarov fixator. And this is the view. You can see all was corrected and lengthening of the thumb was done. And so now see, he can write 18 years old patient with his hand. This is before and this is after. Now, this is you can see here, it's a very bad case. Exposed bone and tendons, machinery injury right hand, deep multiple laceration with multiple tendon injuries. So, you can see here, put the Ilizarov apparatus, one ring here, and this is the arch with hinges, sequential doing dressing. Skin grafting was done, and then this is probably this person from UK, Indian. He had a Bijoy Bada. He was with me, and this fellow is from Malaysia. They did the fellowship here in my center, and this is the case with mini Ilizarov fixator. This boy, he came from Saudi Arabia for treatment like that, and he was like that. See, only 3 fingers, and then he could work with this. This is the thumb. You can see here, trauma came to my place, post-traumatic shortening. It was like that, right hand and left hand. Then what I have done, you just see, I have done a lengthening. The wires that I have band, you can see, this is the band, this is the mini fixator. 2 wires. And then I have lengthening this one, middle one. See, look at this. This is the very good regenerate bone. Lengthening part, you can see here tube just like a tube, and this is the lengthening part with mini fixator. And then you can see here, this was lengthening part. This is before, and this is the after. You can see here, this is almost the equal size after 4 months only. 15 years old boy with flexion contracture of the right distal IP joint, just of the trauma, and he came to my place. Look at this here. This is this one. Look at the X-ray, and this was the situation. Then I started doing fixing with mini fixator. What I have done, you can see here, just one bow here, mini fixator, and here is the distal part was angulated. I put 2 wires here, 2 fixation and olive. Gradually I have, you can see here, I have just pulled out this one and distally, and the fixation was like that. The mini fixator, 1 arch, the bow, and then gradually, see, this is almost corrected, almost corrected. Before that, and this is after. Now, 16 years old boy, again machinery injury with gangrene of the middle and ring finger of the right hand. Look at this. So, if this situation came to my center, then what I have done, put mini Ilizarov, 1 arch here, and these are the fixation, and then you see in the same sitting, not that I have done the imputed all the cases, no. Gradually I have followed the case, and then what happened, see, from this situation to that situation. Patient is happy. This is the follow-up. You can see here, this is okay, but I suggested him to go for lengthening, and then he came to my place, and later on he told me that he will come again and I'll do the lengthening. So this is the 35 years man, neglected open injury. You can see the swelling. You can see here with infection. Then what I did, just see, I put the fixator with mini Ilizarov here, and here you can see this is the fixation, and then look at this, from that situation to this situation, patient is happy, and it is only a follow-up after 3 months. Look at this, again machinery injury of the right middle finger, bone is exposed, and then I decided to go for again mini Ilizarov fixator. This is during treatment. Now you can see in the C arm how I have put the wires. You can see this is a fixator. The wire is bent. You can fix it washer here and with fixator. And then finally you can see after treatment, finally, this is a little bit angulation, but from here lateral side you can see the good callus formation and lengthening part of this part with good regenerated bone. So this is a very bad case with again machinery injury of the forearm and the hand. Came to my place. What to do? A late case came. See, again after trauma, fixation with the radius ulna and hand. Gradually we treated the patient, and then you can see the situation from their side to this condition. Thumb was like that, and then 2 rings here initially, and gradually we treated this one. And as a result, what happened, you can see here. Initially it was a non-union, a little bit, and then healed later on. And this was the situation of the hand overall after 7 months follow-up. This is a teacher of a college. You can see here, after trauma came to my place with, you can find here, why is the fracture? Angulation of the fifth metacarpal, you can see here angulation. Just you can put plaster. No. And then you can correct easily whenever you put the mini Ilizarov fixator You can see here, this is what I have done. Many two wires here bending. This is bending. You have corrected the angulation. This is angulation is corrected, and patient teacher is happy. And just this is the model in my table. The teacher is looking the same case in the left hand. You can see here. So this is the situation. Angulation is corrected, is healed, and patient is happy. So these are the comminuted interarticular fractures of the distal radius. You can see here difficult case, very difficult case. Ilizarov fixator is always good for this kind of combination. And see how I have corrected this one with the bow, two rings here, and you can correct this one. Look at this lateral view and look at the AP view. Now, this situation from that situation with clinical appearance of the patient, you can just see after 3 months follow-up. Now, very simple case. You can see, you can put the split also. Angulation, this one, fifth metacarpal shaft of the fifth metacarpal with angulation. Now, what I have done, see, young chap, second day after application of the mini Ilizarov, very simple, bending the voice is very important. And then this is corrected. The radiograph you can see here. Now, at the same sitting, no, don't need to put plaster or spleen, and he could write. You can see here, this is already healing process is going on. Regenerated bone, angulation is corrected. Patient is writing, yeah, with a smiling face. And this is the final view. You can see from this situation to this situation with mini Ilizarov fixator after 2 months follow-up. This is also published in MedCrave in 2016. See, I have done the cases. And you can see here 2016, 4th October. This is publication in MedCrave journal. You see, whenever you are putting Ilizarov in the hand, patient can do any kind of exercises, and healing process will be very good when you advise your patient with the fixator to go for exercises. So I always tell this, complications of Ilizarov technique during treatment are inadequate knowledge, improper technique, violation of the original Russian Ilizarov principles, lack of skill, intelligent meticulous follow-up, lack of patience, and hybridization. So these are the few cases that I have shown you, the how you can put the Ilizarov in closed and open trauma cases of the hand. So these are my, till today, you see, I have 90 international articles published and 7 books. And this is very important. What I showed you, this is my evidence. And on the basis of biology and mechanical stability, mechanical technology, I showed you the science and surgical skill of the patient. And we are doing a lot of cases in my country, and we are getting very good and fantastic result. Thank you so much, my dear friend, for your patient hearing.
Thank you very much, sir, for your excellent presentation. By putting Ilizarov, definitely we can avoid the post-plaster stiffness of wrist joint, and we can make the patient more ambulatory. And definitely it is a fantastic options for hand surgery. And I would like to request Dr. Shamsul Huda sir to say something regarding the presentation.
Thank you, Dr. Tanvir. Baris sir, wonderful lecture about hand surgery. Normally we are using Ilizarov and tibia femur, and I can see a variety of cases. I can learn a lot from these cases that we can do lengthening, we can use for osteomyelitis, we can do for different deformities, like even burn contractures. There are a variety of cases that we usually neglect in our OPDs, that this cannot be done, this can be left as such. But with the magic of Ilizarov, with your teachings, we can do magic in all the cases. We can give a normal limb, normal length to all the fingers. With this, thank you, sir. Thanks a lot, sir. Wonderful learning, sir.
Thank you very much, Dr. Shamsulullah sir. Yes, that is the magic. That is the magic of Ilizarov, and the magic of Ilizarov can touch the everywhere in the body as well as in the hand. And definitely, we hope we will continue the Ilizarov in hand surgery in the coming part of our program. And I hope our legendary Ilizarov surgeon, Professor Mufakrul Bari sir, will show more slides and more innovative things in the coming part of our program. I would like to thank Raj TV for helping us to do this sort of programs, and definitely Renata Pharmaceuticals Limited for sponsoring our program. And I'm Dr. Tanvir Ashraf saying bye-bye today, and hope we'll connect in the coming Friday with another Elizarov topic. Till then, bye-bye.
Thank you.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe.